entertainment. Wake Up GI with Jeffrey Smith. Brought to you by the Geary Community Schools Corporation.
All right, everybody, guess what? We're back. Once again, it's a beautiful Thursday, and guess what? It's still February. Yeah, because it's leap year. It's the 29th of February, 2024, and this is Wake Up GI with Jeffrey Smith. We got a wonderful young lady in studio today. She's been in here before, and I always get your organization. I don't know the acronym, so I'll let you go out here and kind of introduce it, but it's CANI, correct?
Can I?
Can I? See, there you go. That's why I didn't want to get involved. But go ahead and introduce yourself and tell us about the Can I organization.
Good morning, everyone. My name is Nicole Otis. I am the Outreach Director with Community Advocates of Northern Indiana, better known as Can I.
Yeah.
We are an organization that works to end health disparities in Black and Brown communities.
Right.
Among Lake and Porter County.
Right. Yeah, I remember you've been on this show before. We've talked about that because when you think about, health disparities and things like that, once again, I think it got exacerbated during the pandemic. We really, really saw, like certain communities were just getting hit harder than the others as far as resources. And I have the pleasure of once a month Dr. Seabrook sits where you sit. And as somebody who's out there on the trenches like you are, she always kind of talks about, it's still more work to be done. And now on top of that, we're dealing with shortages in the medical field as it relates to personnel. So that's kind of crazy and blows my mind. We got another young lady who's in here with you today. She just kind of came in and joined you. Introduce yourself. Put the mic up just a little.
Sure. Good morning. I'm Tracy Lewis, Director of Community Advocates of Northern Indiana, and just so glad to be here on the show again, Jeff, and thank God for a tremendous colleague and partner, and she just does so much with Nicole. So just pleased to be here.
Absolutely. It's great to see you again, Tracy, as well, because you and I, last time you were here, we had a pretty interesting discussion. I remember that.
Yeah.
So, as I said before, I love this conversation. So either one of you start. What are you all up to now? What are some of the initiatives that you are pushing? Because this thing is ongoing. I guess we'll go to Tracy.
Absolutely. Although it could be either one of us. But we're so excited, Jeff, about convening partners to have discussions that are going to impact folks' lives. And
right.
So we have a number of different community conversations coming up.
Mm-hmm.
One is the cannabis question.
Oh.
Yep. We're looking at all the legislation that shows us that it's coming.
Right.
The legalization of marijuana in Indiana. And so we want to hear from both sides of the discussion,
mm-hmm.
folks who are pro and folks who are con. We're going to invite legislators to be there, and so it'll be somewhat of a town hall format, but very much we want to hear from community. We want to inform community and share with them, what does this mean medically?
Mm-hmm.
What's the difference between smoking one way or edibles or just everything that comes into that discussion, and then make sure that we can prepare for it. As well, we're going to have someone who in Michigan has its own cannabis corporation.
Right.
And to talk about what the implications are for business and how people can do these things always for us in a way that's healthy, in a way that builds community, and in a way that community gets to give input.
Now, let me just tell you, because this is very interesting, because this is something that I have been following for a number of years. A former state senator who's back in the private sector, Ms. Karen Tallian from Ogden Dunes. This used to be her baby. It was just like John Conyers ever since 1971 when he was the representative before he got in trouble during the Me Too movement. But one of the things he used to do at the beginning of the session, even though it was just symbolic, was always put forth a reparations bill. That was Karen. She'd always go down there and put out the marijuana bill to go out here and kind of decriminalize it and bring what she felt Indiana into the 21st century. Now, having said that, it's a real interesting dynamic and conversation about that. First of all, we're Indiana. And so Indiana is kind of hesitant towards that. Now, real quick, I'm not going to go off any tangents, but what's very interesting about this is Indiana is a place that does not necessarily believe in farm subsidies, but we still do have some family farms left. You can get into the argument about legally grown hemp, and then now we call it cannabis without those restrictions. This could save family farms and really kind of reignite the industry. So you got that going for you. Number two, We are also a big pharma state, in particular down in central Indiana. Eli Lilly and Big Pharma, which I'm sure they're no fan of mine whenever they get wind of some of the stuff I say. I'm not a fan of theirs. They're not necessarily in any rush for this kind of holistic medical approach to start to come in. I mean, there are a lot of people who go through pains, and after the opioid epidemic would love to be able to go and do medicinal marijuana. They go out here and have to get into some of these drugs that have fentanyl in it and all that kind of stuff that can lead to some bigger problems with addiction. So you got that going on. And then number three, I think probably most important downstate is they don't know how to tax it yet. You know, I mean, they haven't figured out the model that they want to use. We've been so busy concentrating on our gaming as our vice, but the three states around us, Ohio now, Michigan, Illinois, now Kentucky's getting into the medical. So we're like the oasis in the middle that doesn't want to touch it. And oh, by the way, if you're listening on the road, don't drive through here with any marijuana in your car because you will get prosecuted. But and so, as I said, it's so many different levels. And then you brought up the economical part of it. Now, this is where I will give Illinois some props. They started to really early on empower people in these communities, specifically the Black and brown communities, to go out here and really get in on this on the ground level. And you saw, they learned the restrictions, they learned how to do the taxes and all that kind of thing necessary to kind of avoid the federal government. Well, it's still illegal, but they're also benefiting from this. And so, as I said, this is kind of cool, but it can go on for days because there's so many levels to it.
Absolutely. And I love that. I mean, you're thoroughly informed about it, and I love the points that you raised.
Yeah.
The criminalization is another big thing that we want to get at because we're sandwiched between Michigan and Illinois. There are folks who can go into Illinois and purchase this and come back into Indiana anyway. As you know, in Northwest Indiana in particular, we're 20 minutes away.
Oh, absolutely.
And so, for folks to drive right to border areas like Cal City and come back, it just is bizarre that someone could do that and then someone who's here could be arrested. Yeah. It just becomes so blurry. And so there are about 5 different bills out there being debated right now.
Yeah.
And they all deal with some form of legalization. Yeah. And so, as I said, we just want to get ahead of it. And I love the things that you raise, and perhaps you would be our moderator. I'm going to just put that out there.
Here you go.
But yes, it's so much. You're right. We could go on and on. But that's why we want to have the discussion.
No, I like that. I think it's time because, bringing it back to the health aspect of it, I want you to weigh in as well, is that, I always just use the example of, I remember when my father was really starting to get sick, he had started getting his heart problems. My dad, was a very active man, and he was a principal, and he was always out doing stuff. And I remember coming home from college, and, I'm the only child. I remember my dad was telling me to give him some pills, and I'll just always forget this. And this has put my slant against Big Pharma, even though at the time I was like in veterinary medical school and I was taking pharmacology. But I opened it up. My dad had 11 prescriptions. And he was so lethargic, and the way he would sit in a chair and just kind of nod off and sometimes come in and out and things like that. I just always told myself there had to be a better way. And so when I look forward and I see what happened in the past, 10 years with the opioid epidemic, which a lot of that started with people who were just trying to deal with some aggressive pain. Yeah. And then it just got out of hand. And so there, outside of obviously people using it for the recreational reasons, and I get it, and I know people want to tax it and they've got opinions. People do deserve options to not have to take all that because those are synthetics. I mean, you can get into the science of it and say, medical marijuana is more, closer to the earth, and it's more pure, and that's a whole nother thing. But I just think that people deserve to have that option. Thoughts? Nicole, yeah, just weigh in on it. I know she's like, yep.
But actually, absolutely, I believe in options.
Yeah.
And I think with true guidance, having your doctor part of that conversation, you will then have options.
Yes.
But right now, you're stuck with what they want to give you.
Right. And as you, I'm sure all of you have seen it. You just see people who are suffering, and they don't deserve that, and they don't also. And a lot of people avoid going to the doctor. I talk to people all the time because they don't want to take those pills. They don't want to feel like they're not themselves. And so, as I said, in particular, I saw a lot of this happen for people, some women that were going through chemo. They were just looking for some way out because they were feeling nauseous and sick, and they didn't want any more pills on top of that, you know, what they were already going through. So I think this is a pretty cool conversation. So Nicole, what are some of the other things you all up to?
So we are actually on the verge of having different community conversations in addition to that one.
Yeah.
And we would like to do a monthly coffee and conversation.
Yes.
So we're looking for organizations that we'll be partnering with. One organization we do partner with now is Jay's Breakfast Club.
Yeah.
We just had our heart health conversation. So that was a very great success. But we like to meet you where you are.
Right.
So we don't like to come in, offer you a cup of coffee,
I like
give you
that.
some good information, something to help you develop a healthier lifestyle. So we'll be doing that once a month at different locations.
I think that this is absolutely amazing. I want to ask both of you ladies, like, as far as the conversations that you've had, and as you're in the community, where are we at as far as mental health? Have we still I get Edgewater on here all the time, and you know, I have no problems. I think I was talking with some of the people that were on before, and I think I was speaking for a lot of people, that I think one of the things that has happened post-COVID is kind of the introduction of telemedicine. Mm-hmm. And I was talking with Dr. Seabrook about this, and, you know, I was even using myself as an example, is that, you know, while I don't necessarily like, I think people do like the touch and feel of a doctor when it comes down to kind of regular medicine and going to a practice. You know, you don't want to just be staring into a monitor. You want to see who this person is that's asking all these intimate questions. I do think, on the other hand, as far as behavioral medicine goes, and I went to a couple of, you know, I've used it a couple of times myself. Telemedicine gets it done because you don't have to get all in your head about driving to this place and looking at me going in here. You just simply kind of log in on your computer, sit in your room, and you could just kind of open up and be candid and things like that. So, you know, are we talking more about mental health now? Either one, in Tracy or Nicole, either one.
Absolutely. You know, as we kind of brought here before, our pastoral care specialist program with the Cure Souls churches. And so those pastors have completed, and we had a class before them. When the point you raise is so important, Jeff, when you talk about options for how you want to receive behavioral health care. And so the pastoral care specialist way is one. Certainly the telemedicine for the folks who, we've got so many people who contact us and they want some face-to-face. And so we continue to just have those discussions. We continue to look for innovative ways so that we're helping to engage and empower trusted partners like pastors, like influential people from the neighborhood. I teach a community health worker training program, certified community health worker training program, which gives the basics in terms of being able to serve a person who's not quite sure. You know, they're at a transition place in their lives or whatever. To that end, we also have a community conversation coming up that we're going to address teen suicide, mental health and teen suicide. And so we're raising up and bringing speakers to the fore, as well as legislators. In all of these, we're focusing on the legislation that's already out there. We're wanting to inform our public of the resources that are already out there, but talk about what the real needs are. Because next year's a budget year, and the things that we need, the ways that our community is experiencing this post-COVID crisis, as with so many things, it brings out new and different issues. And so whatever the resources that we have that are already out here, teen suicide rates are yet going up in Black and brown communities. And that's because those are not quite a good fit. And so that's what we're going to do with those community conversations, is begin to hear from community on what is it that you feel like you need. And make those connections and say, but this is already out here. And then hear from legislators on how we can work together with them to help to see these things realized, to make sure that we're getting the benefit of the dollars, to be honest, that are needed to equip this community for what it needs to make sure that those rates are going down and not continuing to go up.
You know, last time you heard Tracy, I think you wanted to weigh in on. You got something? No, go ahead, Nicole.
She hit every point that we have.
I saw you nodding in the power to make sure you're.
She hit every point that we have.
I want to make sure we get your lovely voice and your input on this as well. But I remember last time we were talking to Tracy, you were telling me about the partnership and the organization, and I was asking you about the spiritual component to it. And you know, I without getting political, I want to get your thoughts about this, because I see, you know, in particular when you're talking about Black and brown communities, once again, in a state like Indiana, and I'm not putting my Republican hat on or anything like that, but
you have one?
Yeah, unfortunately.
Mm-hmm. No, I'm kidding. I'm kidding.
No.
We're in America.
No, absolutely.
I'm just being silly.
No, but what I'm saying is that it does seem that, you know, when it comes down to kind of this spiritual approach and things like that, I don't know what it is. It just seems like it's always been like the outlier. It's a missing component. I mean, I think we can go out here and we can pass legislation all we want, but you know, it seems like a program like yours in which you're kind of adding somewhat of, you're kind of filling a void. I'm not saying you got to go out here and convert people to any specific doctrine or things like that, but if you're dealing with people, in particular teen suicide, or people that are at risk, people that are in their low places, and you're trying to bring them up, I think it's more than just throwing money and passing legislation. I think you're going to have to also fill a void in a person's life and kind of help them to be able to help themselves going forward. And a lot of times that just comes from a little faith, as I said, no matter where they find it. And I understand you got to separate church and state, but it does seem like a state like Indiana has been a lot more receptive to that. Now, it is being used politically, but you as I was listening to you talk, I see some maneuverability in that.
I think you're absolutely right. And one of the things we want to always drive home is this is not about conversion.
Right.
This is only about finding those folks who are already trusted and already influential in our community. And so in Black and brown communities, often those are folks in the church.
It's the preacher.
It's the preachers. It's right. The deacons, the deaconesses, the nurses, the mothers. Right. Interesting.
The first lady.
Come on now. Right. We know. And so because they're trusted, we want to make sure that they're equipped. That's part of the reason why we wanted everyone to be a certified community health worker.
Right.
So that it's not only the spiritual aspect, which personally I believe is very, very important.
I do too.
But it's also that this is a person who feels a commitment, I would even say a call, to do this work.
Right.
And so, and as you say, in a state like Indiana, I'm hoping because it's somewhat a type of
value based. Let's call it value. Let's call it value based.
Right. That we do have that maneuverability. And so when we talk about dollars, I'm thinking about the fact that the program that we have that was funded has reached the end of its funding.
Right.
And so we'd love to see it continue. Just a myriad of different resources that need to be made available because they're not now.
Right.
Is the reason that we raise up the issues with the funding, the equipping, the educating, the informing, the caring, the embracing, and all of that.
And getting the message
out.
Yes.
But the pieces that have to do with personal responsibility and things like that, that's part of the reason that we're out here having these conversations. And those aren't the only, we're in schools. Nicole, you can talk about a lot of the mental health, anxiety, and stuff we do with teens and whatever in schools.
Yeah, what's that look like?
Boys and Girls Club.
Right.
We'll have a mental health professional come in and just sit down and have conversation with the youth to find out what is important to you. What are the things that's on your mind?
Right.
What are you thinking about? And honestly, suicide came up too many times.
Of course,
Too much. And not just from a child's personal, like I'm thinking about it, but just knowing friends or having lost a friend to suicide.
Yeah.
So being able to have the resources to send that mental health professional in to have those conversations. And surprisingly, it's basically group therapy, but it actually worked.
Right.
You would think some people would be open to talking, but once one person talks a little, it gives the next person some courage to speak a little. Then next thing you know, it's like wildfire spreading through the room.
I believe
everybody is talking and sharing, and we can take that information to see who needs to dive deeper. What needs to happen next.
No, see, I like that because as you were talking, that's exactly what I was thinking. It was like, okay, is there a way to quantify this and kind of send it to the state? Because another pitch that I see you all using is that this is a way of reporting and getting the information back to, the state about, listen, we've got some young people that are at risk. And, you know, the toothpaste is out of the tube, I always say, but it's just very unfortunate that young people nowadays have had a lot of their youth taken away from them, and they got a lot of adult on them. I mean, you know, if they're not out here dealing with violence that they see right there at their footstep. When I was growing up, you know, I just tell the story, I'm not going to tell it now, but, you know, if you lost you know, if I was even in high school and you lost a peer, whether you went to Wallace or work, it was a big deal. I mean, you know, because
it was so rare.
Because the community lost a young person. And so you had to sit and talk about it. You had to process what happened. You know, a lot of times, unfortunately, it might be, you know, drunk driving or some accident like that, but you didn't see people go around here getting shot and things of that nature. This is the reality. You got a lot more young people that are involved in, unfortunately, becoming parents, and then obviously, you know, a lot of people that are getting abused that go underreported. So I think that there's a lot of reasoning that I can see the state taking for going out here funding a program like that, because it's also getting some very valuable data on how to make some of the existing organizations or bureaucracies that they already have more efficient, because you have the data. Yeah. Well,
you know what? That's the huge point. And that's why these conversations and these health presentations are so important.
Yeah.
Because these are voices that you don't usually hear from downstate.
No.
And so that's a great point you raised. And then the other thing, with those, what is mental health? We know that when someone is shot, you know, we're adults, we know that this is a mental health crisis, and that there's trauma. But a lot of times, a lot of the young folks just think they have anger issues.
Yes.
And because of that, you know, with the criminalization of mischief, boyhood mischief,
right.
You know, it turns it into something that becomes their identity,
right.
As opposed to, actually, you'll just need some care.
Yeah.
And it's not your fault, but your responsibility. And then providing tools. But we really want to uncover and say all of these things that happen to you impact you in a certain way. And these responses to it are what make up your mental health.
Yes.
And it's appropriate to have it addressed.
Yeah.
You know, so if you broke your arm, you go to a doctor. If you have a broken spirit, if you witness trauma, if we can go on and on, but just really to begin to provide more education and information so that they don't feel like they have to grow up.
Right.
You know, if you got a boo-boo when you're little, you take it to somebody.
Exactly.
But when you get to those tween, teen, and young adult years, you know, they just try and be strong enough to handle it.
Yeah.
And that's where we really want to step in with an intervention that says, let us provide some resources and change some thinking and patterns around it.
I think that would absolutely be a big deal, because to your point real quick, and you know, is that I still believe that, you know, despite of how the world has changed and how it's viewing younger people, they're still young people. I mean, I can just remember, you know, just going back even in my teens when I first lost my dog, and I was really dealing with death very close to me. I had my grandparents pass, but I'm talking about it really was very personal to me. And I sit and I look at some of these young people that are involved in some of this violence and the shootings and things like that. And even though they're out here portraying hard and things like that, it has to weigh up on you that you're about to go out here and kill somebody. I mean, you know what that's about, and that has to weigh on your psyche as well. And you're trying to build on it and numb yourself with substance abuse and all these other things that become more prevalent in your life subsequently because you're hurting. And so I think that this is absolutely the way to go. And I just applaud you ladies for starting these conversations. So when are we going to start seeing some of these forums?
Monthly, March 16th, April.
Yeah.
You know, we've got some flyers that are come out, but I do have the dates. Give me a hot minute.
Yeah, go ahead, Nicole. I know you got some.
March 16th.
Cannabis conversation.
Cannabis question, thank you.
Wait a minute, what's the cannabis question?
That was the March 16th.
Okay, all right, there you go.
And then April 13th is the one that deals with teen suicide.
Yeah.
And May 4th, we have our last one that is addressing infant mortality, infant and maternal mortality.
Yeah.
A remembrance gathering and a balloon release.
Yeah, I mean, and I know we don't have that much time left. I remember talking to Dr. Seabrook or asking her, I'd like to get you all's opinion. Maybe you can explain, because I'm a dude, so I'm very limited in my understanding right here. I mean, it's crazy, but Indiana, as much as I love this state, I think it's one of the better in the lower 48. but we've got a high infant mortality rate, in particular with mothers. What's going on, just from you all's observations?
It's the doctors.
Yeah.
Come on, Amber said it's the doctor's in it. I'm going to tell you what. So it's systemic racism.
Yeah.
There's great data that shows that Black moms are not validated or listened to. And that at that very crucial time, that's a woman is most vulnerable.
Yeah.
When she's delivering a baby.
Yes.
And we saw.
It's the most violent thing that a body can go through.
Exactly.
Yeah.
And so it's really important to hear what mom is saying about her body. It's really important to prepare mom's body before the baby comes. It's really important to have a doctor who knows of interventions and is familiar with the differences between a Black mom and a mom who's from a different community or ethnicity.
Yeah.
And so we have seen, like with Serena Williams and a lot of high-profile people, how had they not had the resources and the influence and the money that they have, they could not be with us.
Right.
And so if you think of that's what Serena Williams deals with, and then imagine you're just a mom here in Lake County, and we've got great Black doctors, but not a whole lot. Just in having someone speak at our events, we always are calling on the wonderful Dr. Supra.
Yeah.
She
can't be everywhere.
Right.
Yeah.
She gotta have a life. So we've got a few, but that means that many times moms are not being seen by Black doctors.
Yeah.
And even if it's not intentional, they're not being validated, they're not being heard, and that matters.
Yeah, well, and I would just want to ask you an add-on to it, because, as we look at the shortage in medicine, period, I want medicine. It's not even, just about the Black doctor. I think the medical profession should start to kind of open up, because I go back to, what was it, maybe the 90s or something, and, we started talking about what women were going through on the back end of birth, after when Brooke Shields came out and started talking about her postpartum depression. Everybody was like, what the heck is this? You just had a baby. Why aren't you happy? And she was just like, you know what? I've been depressed for about 11 months, and it's just been kind of wearing me down. So I also think that, I can almost speculate that, Black and brown communities, unless you have some severe resources, these services aren't being offered to people in this community, because I'm sure women go through the very same things. Am I good enough? Am I treating my baby right? How am I? And all that stuff that gets in your head after 9 months of carrying this wonderful blessing. Go ahead.
Also, the other issue is this is a medical and mental health desert.
Yeah.
Just like it's a food desert.
Yeah.
So even if you do have the resources and you know what to do, you make that call, that wait list is forever.
Yeah.
So that's another thing that needs to be addressed. Being able to bring those doctors, those professionals into this area, making this an area that they would like to practice medicine, so that we have more available.
Yeah, I like that. You know what? This is all linked. I know we don't have time to solve all the world's problems today, but let's just try with a couple in front of us, because this is one of those things that over the weekend, I wish you all could have been there and possibly added to it when we were talking with when I was talking with the Chancellor and Dr. Frank of IUN, because it's all relative, it's all related. Because as you just broke down, Nicole, this is something that, as you explain it to, let's just say, some young people, some high school people, now there are people out there that maybe hear there's a calling out there. You get what I'm saying? That now there's something that now I know I want to do something to help my community. I want to go to college. I want to get involved in the health profession, and then I'm coming back to the community, because we're going to start having to farm our own talent. Because if we're sitting waiting for some kind of white rabbit to pop up and all these doctors drop down, it's not going to work like that. Exactly. We're going to have to start growing our own.
Exactly.
Yeah.
That's it. And just I want to go back and hit the point about with Black moms. I was fortunate and honored to be invited to speak to some medical school students just before they graduated.
See, nice.
Hey, what can we do?
Yeah.
And I said, really, all of the data shows at the very base level, when a Black mom shares with you her issues, whatever she's going through,
pain or whatever, right?
Believe her.
Yeah.
That's it. That's it. And so yes, we can work on this from, like you said, we got to bring more doctors into this area, but also, like you said, that probably won't happen overnight. The fact that we have so few who are Black doctors, and really there's not that distrust of what they're saying. So then we're working really hard also to say, let us be a part of these conversations to say, this is what you can do.
Yes.
We're all here working together.
Yeah.
And if you don't listen to mom, it has the risk is devastating. And so we got to do that.
Absolutely, ladies. I once again, it's always awesome, and I'm smarter for it. I hope I'm not making you dumber for sitting around here.
No,
with me.
we're smarter.
But anyway, with that, I want you to go out here and give information about your wonderful organization, because there might be people out here that did not understand about the training that you helped guide them to get, so they can go back and bring it to their community and be a partner with you. And then there are people who just want to roll with you, just want to be a part of your organization, want to know how to join, and then they want to know how to reach you. So give me the whole 9.
Absolutely. So we are community advocates of Northern Indiana. canihelp.org.in is our website. Please reach us on our social media channels where we have all the information, the flyers, as well, registration.
Mm-hmm.
You can also register the website. Feel free to call us at 219-885-9755. And then, let me say that again. 219-885-9755.
See, that was nice of you, Nicole. But see, trust me, the audience is used to this because I talk fast. Go ahead.
I just know we're up against it.
No, you go ahead.
Yep. But all the information is there. Really, the social media channels, and we got to say, shouts out and much thanks to CWIT PR. Amber over here is always here, posting and making sure that our social media is up to date. We've got our own team keep the events up to date out in sauce as well. And so we're just so pleased and feel so grateful to be here on the show. Thank you for having us.
Of course.
So much. And thank you to everyone who's been listening and along with us. We couldn't do this journey without our community. And so together we're better, and we move forward with that. And always many thanks to Nicole.
Absolutely, Nicole. Thank you very much. I want to thank you, ladies. I think you're doing yeoman's work. And keep me updated about what's going on, definitely, because I'm kind of curious now.
You're going to call about that candidate.
All right.
You look for that call. It's coming.
You're going to get people start thinking. All right, tell you what, we're going to take a break. We'll be back in just a little bit. You're listening to Wake